forums with women with the disease and what they were feeling and what kind of pain they were in and what they've been through. That helped me a lot to identify if I had actually the same kind of level of disease, because that's, at first it was so hard to define it. And when somebody asks you about your pain, it's really, it's so personal. And so reading through forums of all those women helped me to identify that it was actually quite serious, because I could see others that were, you know, a lot less than me and were already treated, and I thought, oh, I'm probably in a stage where it's already advanced.
Talking to others, I think that's the main thing, because doctors give you a very scientific approach. They don't have a lot of time for you, while if you find other women or men out there, you know, whoever, suffering pain, then they have more time for you. So that's probably my biggest tip.
Talk to other people and
talk to other people, and definitely, and talk about your pain, because for a long time I didn't, and once I started talking I realised a lot of people are a lot more understanding than you think. And when I told work I was a bit worried, but they've all been really helpful, and when I'm having a bad day I find that they're very understanding. So I do think just talking about it and not holding it all in.
I tried. The pain was really hard to tackle, because as I say, it was coming from different fronts and out of the blue. I couldn't predict when and for how long it would last. So reducing stress, that's what everybody tells you, but the thing is you are stressed constantly, and fighting the stress when you are stressed, it's impossible. So I try to meditate, I try to sleep more, I try to have less noise around me, or less to reduce aggression from the outside world, really. And then that helps a lot, but what helped the most, I think, was once I had the name, nearly 8 years later, and I could read about and how the disease functions and what it does and what we don't know, and it helped me a lot. Reading was my saving grace.